I'm Jordan Vaughn. Welcome to the We Care podcast.
And I'm Molly Cooey, RN at We Care.
So today we are going to get started with talking about dermal fillers, who they're for, who they're not for. We're going to talk all things and even about the horror stories. So, Molly, what are dermal fillers?
So dermal fillers are essentially a gel-like substance. Typically, they're made of hyaluronic acid, which is something that's naturally produced in the body. This hyaluronic acid is just, made in a lab. So dermal fillers are used to add volume, smooth lines. Essentially, in our 20s and 30s, we start to lose volume. We break down collagen. We break down elastin. We break down those fat pads. It leads to those nice little sagging jowls that everybody loves so much. And so we use filler to kind of restore that volume loss.
I don't think people really realize how much fillers can just naturally enhance their features, and how I think everybody goes to the horror stories because they, think of Hollywood or overfilled, and they just go straight to that. So let's talk about more of the safety of them and how natural they can be.
Okay. So dermal fillers are extremely safe when injected by a medical professional that has been trained in safety protocols, anatomy, and how to choose the correct product. When someone is injecting in their living room because they've watched a TikTok tutorial,
yes,
that's not so safe.
No.
So you and I have both been trained extensively in safety protocols, aspiration, anatomy, injecting slowly,
yes,
and safety matters.
So just today, talking about aspiration, I have to talk about this. I had a patient that I was injecting her chin. And the technique that I was trained on for chin filler is, we change the needle every time. We're aspirating because it is a safety risk. It is that zone. There are so many arteries and vessels. So I was injecting her chin today, and whenever I went in and I pulled back to aspirate, it was not in the first 2 or 3 seconds. I was literally about to let go of the syringe, and here come blood flying back in my syringe. So I just, removed the needle, held some pressure, all the things. And me and the patient were even talking about it. And she was like, you've explained it to me before, but I never thought that would ever happen. So if I wouldn't have done that, I could have just injected filler into her artery. So it was a little scary moment for me, but
it could have been even scarier.
Exactly.
But because you knew what to do, you were able to avoid that.
Yes. So I definitely think that people need to make sure that their injector is highly trained and using the safest techniques, and definitely not the living room. So let's break down the most common areas that we can do fillers. I would definitely say my favorite is probably cheeks, and just how you're getting that natural lift, and really just the aging face. So cheeks are one of the things that people are really scared of because they don't want to be overdone or too contoured, or is it Cruella de Vil? Is that how you say her name? They don't want to look like her.
Or Maleficent.
Maleficent. There you go. That one. So cheeks are one area that we can do. Lips. Everybody loves, their lip filler, but then some are really scared of the lips too.
That's my favorite spot to inject.
Yes. I think lips are so satisfying just because you see that instant gratification. Okay. And some of the other areas, you really gotta, let it settle, and it takes time. It's not like lips are just beautiful as soon as you inject them. Other areas, nasolabial folds, that's a nice area to treat, but I feel like sometimes it can get overfilled in the nasolabial fold area. I feel like some injectors want to go straight in there and not pull from maybe the temples or the cheek structure. So,
right.
And temples, that's another area that we can inject. Mm-hmm. And did I miss any? Under eyes. Under eyes is another area that's a really pretty area to inject, but not everyone is a candidate for that. And they come in, they're like, I want these bags gone. Well, you can't necessarily go in just because you have a bag. It's more if you have a hollow, we can inject that area.
That's how I explain it to patients too when they come in. When they have bags under their eyes, that filler is just going to be attracted to that bag and it's going to accentuate it. It's not going to make it look better.
Pulling fluid.
Right.
Our fillers, they draw water to that area, which is really nice in the lips. It gives it a nice hydrated plump. But if you put that underneath the eye and you're not a candidate for it and you have a bag, it's just going to accentuate that bag and it's going to look even worse.
Right.
So
it's important to point out here that all of these, there's a ton of areas that we just listed that you can inject with filler, but you don't approach these areas the same way. So we use needles, we use cannulas, and even just saying you're using a needle, it's still different angles, different placement, placing the product with that needle, whether we're on bone or a little more superficial, or the cannula, even we can use it deeper and more superficial.
Right.
So it's just important to note that even though you're coming in for a filler appointment, no two filler appointments look the same because they are customized to exactly how much product we need to put to fill that volume loss in that area. And it's not going to be the same for every person.
Right. Absolutely. So a lot of people, when they're coming in, they're asking about like longevity and how long is this going to last, and they're comparing it to Botox. So how long does filler actually last?
So in general, filler is going to last a lot longer than your neurotoxins are. So when looking at the cheeks, typically looking at 12 to 18 months. Nasolabial folds, 12 months. Lips, 6 to 12 months. Tear troughs, 12, 24 months. It really just depends. Temples, 16 months, something like that. I will say, though, that just because, they've done studies and say that the product should last this long does not mean that everybody breaks the product down the same way.
Right.
So we have people that tend to break down products really fast, like our extreme athletes or like CrossFitters. Oh my gosh, they blow through product.
And this one girl, I'm like, do you eat your filler? Like, where is it going?
Right. So that's, kind of jumping back to Botox for a second, but the provider that I worked for before, he was a huge CrossFitter, and I could literally put 100 units of neurotoxin in his glabellar complex between his eyebrows, and within like 4 weeks it was gone. So everybody is just different. Also, to say that what goes along with this is that just because I tell you, oh, this could last you 6 to 12 months, it does not mean that you automatically need an appointment for more, or that we need to add more in 6 to 12 months. And this is really calling out my lip filler girlies right now, because I have so many that just get in this routine of, well, you told me 6 to 12 months. And so they're back in my chair in 6 to 12 months and their lips still look gorgeous and they think that they just automatically need more. So it's not the case.
Right. It's tough to tell people just because a certain time has passed that, oh, you shouldn't do your filler, but you shouldn't do your filler if you don't need it. So sometimes they come in because we say, 6 to 12 months, and they get in the chair. I'm like, honestly, I think you're good. Right. I really don't think that we should. And me personally, people ask all the time, they're like, did you just get your lips done? No, I haven't done mine in 2 years. I can't believe it. Mm-hmm. But I still feel like they look great. And when I first started getting them done, I did it every 6 months for a couple of, sessions. And then it was like a year later. And now I'm at 2 years later and I still feel like they look great. So I think that, time is different for every single person.
And giving it that proper time for it to break down and actually need to be revived is the more natural way to do it.
Yes.
So,
all right. So what makes someone a good candidate for dermal fillers?
So I think you are a good candidate for filler when you want to change your appearance subtly or enhance your appearance, not necessarily change it. You're dealing with some age-related volume loss, looking dehydrated, just kind of hollowing out. I do not think you are a good candidate for filler when you are wanting to suddenly look like somebody else, or when you bring me in photos that are heavily AI'd and expect me to recreate that on you. And I also do not want people to come in. You're not a good candidate if you have teensy weensy itty bitty little lips and expect to walk out that day with fat juicy lips. So I know I keep
agree.
calling out my lip filler girlies, but it's all about gradual enhancement sometimes.
Yes.
Can I get your lips bigger? Yes, I can, but we can't do it in one appointment. It's going to take time so that it looks natural.
Yes. And so the elephant in the room, what makes people look overfilled?
So a lot of times people look overfilled because of poor product placement, or too much was injected too soon. The injector just wasn't taking into consideration the natural anatomy. Those are the main things that really lead to that overfilled look.
Yes. All right, so let's tell people what a client can expect during a dermal filler treatment appointment.
Sure. So during the appointment, bring them in. We do numb. Mainly, I really only numb lips. I'm not numbing for any other area injections. And then we inject slowly. We inject safely. The goal is, kind of subtle enhancement during that visit. I do feel that it's a very comfortable experience. The lips are, kind of spicy, but I'm also one that frequently changing needles, like you mentioned, during your aspiration today. And I do feel that leads to a better, more comfortable experience.
Yes, I agree. All right, you ready for some myth busting like we did with Botox?
All right, let's go.
Okay. Myth number 1, once you start fillers, you can't stop.
So filler dissolves naturally over time. So if you decide you no longer want to add that filler, you're just going to break it down over time and you're going to continue that natural aging process.
Number 2, fillers will make me look fake.
So bad filler will make you look fake. Good filler will just enhance your natural features.
Number 3, fillers hurt a lot.
So fillers are not super painful. As I mentioned, I do feel that the lips are a little spicy, but good filler injections are not painful.
I agree. Filler and Botox do the same thing.
Fillers and neurotoxins complement each other, but they do not do the exact same thing. Neurotoxin is going to stop muscle movement, where filler is going to restore volume.
Thank you for clearing those up, Molly. And then I do want to mention that if someone is breastfeeding, if they are pregnant, nursing, any of that, they're not a good candidate, or any active infections on the face, or really just anywhere with an active infection. It's not good to do fillers at that point.
Right. So, and if anybody has any questions, we'd love to answer them. Just, drop them in the comments and we'd be happy to reach out and let you know anything about it.
Yes. So that's all for today's episode. Thank you for tuning in, and don't forget to join us next week. We are going to be talking all things thyroid health.
So make sure to subscribe, share this episode, and follow We Care Health and Wellness so that you can see more behind the scenes and educational content. And don't forget that at the end of the day,
we care. Have a great day.